Assalamualaikum and good day to Madam and everyone. We are from Group 8. The chairperson for our group is Daniel William. The secretary for our group is Siti Nurul Haslina. And the three other members is Adeline Ika, Muhammad Haris Izzat, which is myself, and Elvis. So we will present our three best solution today. The first one is introducing community-based medical education, or CBME. There are a lot of benefits for this solution. One of them is students become more aware about the diverse backgrounds of the community. They can grasp a bit about living experiences of different people with multiple languages and distinct social determinants of health. For example, they can learn about the living experiences of people who live in countryside like the Bidayo, Melanau, and other races. Secondly, students obtain more significant learning material. They can understand health from patients' perspectives. According to Claramita et al. 2019, reported that CBME aids students to hone their socio-humanistic abilities via communication and cooperation skills to fully appreciate the social factors of health, such as age, occupation, and living environment. The last one is students can improve their intercultural communication skills, and this positively impacts our faculty by enhancing our medical curriculum to develop competent pro-diversity medical students. Other than that, we also think of the disadvantages or the downside of this solution and ways to counter them. So the first one is difficulty to supervise all students at once in an unfamiliar community environment. So the ways to counter it is we can divide the students into smaller groups and each group will visit the place in rotation. We also can select a few venues, then assign different groups to different venues. The next one is full participation from both students and the community because of language barrier and cultural differences. For example, like I said just now, there are a lot of races in the countryside other than Iban, Lanao, Bidayo, and many more. So we can give a proper briefing about the general epidemiology of the community setting so that students can prepare themselves accordingly.
As for the implementation of this solution, it is mainly based on the foster family program. First of all, we will select a suitable village and preferably the one that is close to the campus. And the volunteers from this selected village will be the foster families for our students. Our students will be divided into small groups of 4 to 5 students, and each group will be assigned to their own respective foster family. All activities will be done between students and their own foster family. Health-related activities include foster family history taking to understand the family tree, socio-economic, and the presence of familial disease, health screening, such as blood pressure and body mass index, to evaluate the general health, and also health education, for instance, poster and also video about the management of diarrhea and also stop smoking. These activities are important because students can apply and incorporate knowledge that they have obtained in the class during these activities. So what is the faculty's role in succeeding this program? Okay, aside from being the facilitators of this course, the faculty budget committee will take the responsibility to provide sufficient budget, especially for transportation, as students will use the university bus to go to the selected village. So university bus is used because not all students have driving license, and it is much easier to supervise students that use the same transportation. And then this course will be included in continuous assessments in the form of logbook, reports, and presentations on each visit. And this will allow the facilitators to evaluate students' performance and the effectiveness of this course. Our main targeted outcome of this course is to educate students and as well as the community about health.
The second solution is maximizing cross-racial interaction and encourage discussion among the students. The benefit of this solution includes the student can interact and connect with people of diverse cultures. By interacting with people of different cultures, it could also improve the students' communication and soft skill, which would later on lead to a greater learning and self-improvement among the students. According to study by Chang in 1999 regarding the socializing across race and discussing racial or ethnic issues, the study shows that there is a positive effect on the likelihood that the students would stay enrolled in college and more satisfied with their college experience. The second benefit would be diverse sets of viewpoints in clinical setting. Different sets of viewpoint in the clinical setting is very important in determining the good prognosis of patients' diseases. By discussion, it could help in producing the most appropriate treatment and patient's management. If one technique fails, a unique perspective from different viewpoints can be introduced, evaluated, and adopted. The closest example would be the development of different types of COVID-19 vaccines, such as AstraZeneca, Pfizer, and many more. The last benefit of this solution would be improving the quality of services provided in the healthcare system. The increase in the variety of the healthcare professional could dismantle the barriers that certain patients face when seeking treatment, such as language barrier. By improving the quality of services provided, it could also increase the demand for services from the patients.
However, the downsides of this solution is communication barrier. As we know that Malaysia is a multicultural and multilingual country. But we can counter it by standardizing the language where everyone can understand easily to avoid misconception. We can implement the solution by using the program-based learning module. This module will be available for the clinical phase medical students. Then they will be divided into small groups of 5 to 6 from different races. There will be one professor will serve as facilitator for each group. During discussion, only Bahasa Melayu and English are allowed. The goal of this module is basically to improve students' communication skill, facilitate the students to be culturally competent in managing the patients with diversified background, and also teach the students in exchanging opinion in a respectful manner.
Next, we can promote the practice of cultural sensitivity in hospitals and clinics. The benefits of this solution is the students can learn different understanding of healthcare from various cultures. Other than that, they can communicate effectively with future patients and colleagues despite using different language on a daily basis. And moreover, this will prevent misunderstanding with people around them. Moving on. Study shows that patients who did not speak local language will have difficulty to access the healthcare services. They will also have problems to understand the medical conditions. Other than that, some of them will be confused about the usage of medications and did not understand a label on medication clearly. This shows that language barrier negatively impact the quality of healthcare services. So how are we going to implement this solution? We can organize cultural day in hospitals and clinics. This will be conducted for medical students during their clinical years. Lecturers and facilitators will organize a cultural day every week. For example, Iban Language Day on every Wednesday. The downside is the poor participation from the students. However, we can counter it by including this cultural day in continuous assessment. This will contribute to their carry marks. This solution will improve the students' Iban language skills so that they can communicate easily with patients at hospitals. Most importantly, this will ensure the advancements of healthcare system in rural areas in which most communities are Iban. That concludes our presentation for today. Thank you.